So, cost reduction strategies in a medical practice, rising costs in challenges in a medical practice, and they are going to impact profitability. They're going to impact sustainability. And so, effective cost management is going to be essential in maintaining that high quality patient care and employee satisfaction. And I have seen the effects of that in my experience because a negative impact really does have a trickle effect as well as a positive impact. So you're going to have more staffing options, better workflows. So we're going to talk about some of those today. And, having a cost reduction strategy is really just makes it a little less scary, especially from an operation standpoint. So I hope that some of these are helpful today. So first, how many of us have heard when we ask for a new employee or we want to make some improvements or maybe some upgrades to equipment, we can't afford it. It's not in the budget. I can understand that. I think that we can all agree, we're all consumers, we're all humans, that we can understand this answer to some degree. However, there are many ways that we can reduce costs, which would afford you to spend more or to make those vital improvements. So again, you don't want to just say, hey, we need more staffing, or hey, we need this new equipment. We want to say why, and then we want to give the ways that we're going to reduce costs to implement those. So a couple ways are that we can analyze current expenditures by taking a careful look at both fixed and variable expenses. So fixed expenses are going to be costs that don't change, obviously, with patient volume, like rent, salaries, administrative costs, but understanding those fixed costs will really help to understand the ways that you can save. And then variable costs are ones that fluctuate based on the service volume, like medical supplies, electric bill, etc. And so now I know that this might be an area that you're specifically responsible for in your practice, but it is important to have an understanding so that you can be part of the solution from an operations standpoint. Uh, I when I found out that just how much it was just to keep the lights on in our medical practice, we were paying thousands of dollars. And so I became hyper aware of turning the lights off when I left a room or unplugging an equipment that we didn't need for that day. Like those are ownership things that you can train your staff on to help. Yes, Becky, it's so crazy. The amount of money that you spend on lights, I just heard just in our organization alone, it's over $6,000. And so it's very expensive to just operate and own a building. So just keep those considerations in there. Hi, Jamie. So glad you're here this week.
Me too.
Hello. Hello. So let's talk about from fixed and variable reports, you can identify different areas that are most important to focus on or areas that you can make adjustments or improvements to. So utilizing your financial assessments, maybe you're not the one responsible, but you want to have an understanding, a breakdown of what those expenses are in a general sense. We're spending $100,000 a year on medical supplies. So then your staff, your team knows when, we want to use those expiring things first, et cetera, which we'll talk about a little bit later. Performing a personnel needs assessment. Again, you don't want to just say, you don't want to go to your physician owner, say, we need more staff. You want to have an assessment of specific needs within your practice, what that person is going to look like, what skills do they have, or is it not always about staff? Maybe it's more times than not, it's not really a staffing issue, it's an efficiency issue or a collaboration issue. And so you want to be able to look at those performances. Reviewing your health insurance and retirement plans. I'm assuming that all have those within their practices, but we would set a schedule with our broker every July, I believe it was, to start shopping for better health insurance costs. And then so we were either changing or negotiating with our current healthcare benefits so that we can reduce those. So that's a great area that you can all work towards if you can, or considerations for your practice owners. Analyzing operational efficiencies, of course, looking at different things that you can outsource versus having an employee or a person start. Maybe you can outsource those things to free up the employees that you currently have, which would ultimately save and reduce costs. And then inventory review. We're going to touch on this because it's such a big piece that you all do have control on. But analyzing past usage to understand the demand fluctuations is going to be important. And what that means is maybe you're looking at last year's flu vaccines. Did you throw any out? How many patients do you have now? Are you going to have to order more or less based on those? And so that's going to be a very good, insightful way to look at inventory. I remember once we had over ordered our flu vaccine because we had to place an order in August for flu season. We had ordered over ordered by about 500 doses. And oh man, we never wanted to do that again. So then we way under ordered one year. And so finding that balance is going to be extremely important to cost saving in a practice. So cost reduction strategies from after analysis, after you do the analysis, here's some other ways that you can kind of look at reducing some of those costs. So again, you want to look at the ones that are costing the most in your practice and maybe focus your energies there. So one way is by reviewing your EHR costs and its capabilities. So there are a lot of ways that you can identify and eliminate unnecessary features or add features that will help to streamline versus hiring a new employee. So consider those when you're looking at cost reduction. Carefully reviewing billing reports. This cannot be understated. I mean, we can have 3 office hour topics on this alone, truly, but you need to make sure that those are being looked at on a regular basis. I do want to mention that if you don't know already, our CMA's business partner, Unislink, does do a free analysis, which is extremely comprehensive. Of course, they are a service. They do offer billing support, but this is a free tool that you can use, and it has got tons of information that'll help your practice. And then it'll also give you considerations on whether you need to renegotiate your current contracts. If you're losing money on your patients that are coming in because you have a bad contract, that is absolutely going to affect your operational costs. By definition, you cannot be losing money every time a patient walks through the door. So looking at those are going to be very important. Networking collaboration. This is kind of an interesting topic, and I don't know if anyone does this that's on the call, but collaborating with other practices can lead to shared resources. I had a practice that I worked with, and she was just needing an office manager. What did you do? You have people to speak with in insurance world? Yes. Absolutely. Absolutely. Yes, we can, Jamie. And as a matter of fact, we can talk offline about this because we have a toolkit, first of all, that we can help with. So I want to just mention this since you're talking about this. We do have a toolkit that helps with contract renegotiation. And we just got a business partner proposal, and they do your contract renegotiation analysis as a free benefit. So we're very hopeful. We're vetting them now. No news yet, but definitely out there on the horizon. So pretty exciting stuff. But yes, we have lots of different ways that we can support you in that. And then with practices that have maybe some group purchasing organizations that they work with, that's another way. And also just collaborating with other practices. Your physicians are talking to other physicians in the hospital. They're meeting each other at different social networking events. Those are a great way to say, hey, I am spending so much money on this particular overhead in my practice. What are you doing to save cost there? Or maybe they're like, I don't know, we need a solution too. And those two combined could come up with something. So, having those conversations are going to be really important among providers, and also operations managers too. So these are great ways to support. I wanted to have a slide all its own on inventory and supply management because while those other things may be out of your control because they're more from a physician owner standpoint, these are all in everyone's control. So we're going to start with the top purple arrow, and that's reducing expired products. So having a visual management system that tracks products that are going to be expiring, especially with vaccines and medications. We used, and I don't know if any of you do, but we had supplements in our practice that we would sell. They expired constantly. And because we ordered too much, but also our team wasn't necessarily pulling from the front, or they would just grab and go from the supply closet. Training your staff or alerting, hey, these 4 medications are about to expire. Let's use those first. Let's send out a newsletter saying that we've got 10% off our supplements. These are ways that if you're staying on the pulse of that inventory, that you can help to reduce costs. So reducing red bag waste. Oh my gosh. I don't know if you guys have witnessed this, but those are, and your whole staff should know that oftentimes your biohazard is charged by weight and volume. So I do not want to see anyone's lunch bags in that waste. It should only be very specific items that go in there. And so making sure that the whole team is involved in that as well would really help to reduce. Streamlining, of course, having a just-in-time inventory system so you're not overstocking or understocking certain things, that's going to really help the cash flow in your practice. You want to use all the inventory, not just, oh, I'm ordering, we're out of gloves, so I'm going to go ahead and order Band-Aids and all of these other things at the same time. You want to try to have a reduced overstock of those types of things. And then implementing regular reviews. Of course, I always, always, always go back to this in office hours that you want to be looking at those areas that you find discrepancies in, maintaining accurate records, removing slow moving products or things that are not being used at all in your practice. Because unfortunately, you may have multiple sites or multiple offices. And so it's more difficult to be in control of those things. So having one streamlined area is going to be really great. And reviewing that too. And then finally on this consolidating supply vendors. I remember when we first started working with McKesson, and I don't know what supply vendors you guys are using now, but I was just ordering straight from the website. Once I got an account manager on board, I was able to say, hey, Medline offers it for this amount. Can't McKesson offer the same thing? And so you have more negotiating power, but you've got to be in the know. So paying attention to those things, making sure that all your vendors are giving you the best price that's out there. Those are all important to reducing costs and ways that your whole team can be involved. Maybe you make someone who's a little bit more wasteful in control of the inventory management software. So, we've talked about strategies related to that as well. Any questions or anybody doing this already and they're seeing a lot of good cost savings that you can help the group with?
I know, speaking of McKesson, yeah, they will give you the discount, and then they've actually started a new thing where they give you credit for repeat orders. So like if you're ordering gloves a lot, if you're ordering the table paper a lot, you get a discounted rate on those specific items because of the amount you're ordering.
Oh, that's great. That's great. And I remember, thank you so much for sharing. I remember having to scramble like, oh my gosh, they raised the price of table paper or whatever. And then I was like, at the time, Amazon was just out of selling books. I know I'm dating myself a little bit with this, but, and so I would like search Amazon and search the website, and it was just, yeah, I didn't realize that there was some negotiation power there and support. You just have to ask for it, reach out and grab it. So thank you so much, Becky, for sharing. That's wonderful. And then finally, we all know, we've talked about this at different varying levels throughout the office hours and different training sessions, but improving your operational efficiency is going to help tremendously with cost savings. Again, it's not necessarily about hiring more people or adding more things. It's about really looking at what you're currently doing and seeing if you can make improvements there. So patient scheduling, maybe you have 24/7 online scheduling. I think a lot of you already do, if I remember correctly, but just making sure that you have those in place that are functioning properly, your patients know about it. It's going to really reduce the need for staff in those areas. Not to mention the financial benefits of having that flexible schedule to reduce, no-show rates, et cetera. Energy saving, I mentioned this before, but not just, sharing how much the bills cost, but also, looking at different energy saving things like we replaced all of our light bulbs with LEDs to reduce the cost there. I think it reduced our costs by about 20%, if I remember correctly. That's a significant savings over an annual period. We also looked at HVAC optimization. So we had a really old system. We made energy upgrades. We changed out our panels. Those are ways that you can save in a medical practice. So consider those if you haven't already. Outsourcing, as I mentioned, this is a great way to evaluate what tasks are not necessarily essential. Like you don't necessarily need a person supporting a patient. So IT support, of course, your billing, your coding, maybe even outsourcing your patient calls or scheduling is an option. So that really lowers labor costs and frees up those resources for people to focus on training staff. Let's talk a little bit about, so making sure that you evaluate your billing processes, of course, having a function on there to online pay so that you're not sending out 8 statements. That's going to really reduce your operational costs in that area. So if you don't already have a solution for that, look at those types of supportive issues. And I'm sure we have recommendations for you if you're not already using something like that. I'm happy to help. In fact, as a matter of fact, I worked with a practice who did not have an online pay. I'm using their 8 statements. They would send 8 statements before they sent to collections. Once they implemented that billing, they within 3 months had gotten like $16,000 in patient payments. That's significant. And it was very minimal cost to add something like that to their practice versus having an employee that's either making calls for collections or another employee to send out statements. So yeah, outsourcing these things are very helpful. Implement workflow automations. We've talked about that before from just an easier operation standpoint. If you have better workflows, you're going to have things more tightened and more streamlined, therefore less need for more bodies. I remember, I'll share a story. I worked with a practice who had 3 clinicians. They saw about 240 patients a day or something. Pardon me, they had 5. 240 patients a day with 2 billers. That is inefficient. That's extremely inefficient. And so working with those things. Oh, and they also had 9 medical assistants. So very imbalanced there. So we want to make sure that we have a better balance of those things, maybe by implementing some workflow automation. So again, with staffing efficiency, making sure you're training everyone appropriately, that you have the staff that you need, and that they're all in the roles that are that work for them. And then determine if tasks are being handled efficiently, and then maybe you can combine some tasks. Sometimes you're seeing that multiple people are doing the same thing when really it's a quick process that be handled by one person. So that's especially important. And then this is regular review. Of course, I always have to add that because it's extremely important to go back on a regular basis and review. But these operational efficiencies or improvements are going to be especially important to those that are in capitated populations. So if you have better workflows, obviously your quality incentives across your payers are going to increase. And so you have then more money coming into the practice, which will obviously improve the function of your practice in general. And then always monitoring those things as well.